Welcome to the Barrier Breakdown, Disrupting Mental Health podcast, where we talk about the clinical and practical issues that face those working in the mental health industry.
Hello, everyone, and thank you for joining us on this week's episode of the Barrier Breakdown, Disrupting Mental Health. My name is Erin Molyneux-Bailey. I am the Chief Operating Officer at Cognitive Behavior Institute, and my co-host, Dr. Kevin Caridad, who is the CEO and owner at Cognitive Behavior Institute. On this week's episode, we have two very special guests, Dr. Elizabeth Sysak and Dr. Jack Rozel. Dr. Rozel is an associate professor of psychiatry and adjunct professor of law at University of Pittsburgh. He is the medical director for Resolve Crisis Services, a community crisis program which delivers more than 125,000 services each year, and is the immediate past president of the American Association for Emergency Psychiatry. Dr. Sysak oversees Resolve Crisis Services, Western Psychiatric Hospital Psychiatric Services, WPH Psych Care Plus Admissions, Beaver County Crisis, Mobile Mental Health Therapy, WPH Psych Consult Liaison Program, and WPH Safety Department. She has provided over 30 lectures and presentations on a variety of topics related to motivational interviewing, crisis intervention, trauma, and leadership. In addition to serving as a visiting and adjunct professor to local universities, she serves on the Emergency Department Advisory Board and the Capacity Management Committee for Inpatient Psychiatric Bed Management. Thank you both so much for being here with us this week on the Barrier Breakdown. Could you share with us and our listeners a little bit about Resolve?
Sure. So Resolve is Allegheny County and Western Psychiatric's partnership crisis services. We have a multitude of departments under one roof who all strive to do the same thing: divert folks from hospitalization and try to provide immediate crisis intervention care and support. We have a phone crisis service, which is just as you understand it. People call in, they ask for help. Something as simple as I just need to talk today, and something as serious as I think I'm going to take my own life, somebody else's, and I need immediate help. We also have mobile crisis teams who operate in pairs and go out into the community. They meet you wherever you are in Allegheny County. We have done interventions in vehicles, we've done interventions in alleyways, we've done interventions in homes. They do the same service that our phones do. They assess, they try to diffuse a situation. If somebody calls us at a 10, we're really hoping we can leave them at a 9. Sometimes that's a big success. We have a walk-in residential program that's at the same location. And the walk-in program is just that. You can walk in, walk out at any time. There is no appointment. You come in, you let us know what is going on, what the crisis may be for that day, and our team works with you to identify maybe coping skills you already have that you didn't know. We try to uncover resources and strengths so that ultimately we can get you back out into the community. If your crisis extends beyond a 24-hour need, we have a residential component to that program. We do have 14 beds, so people can stay. Once our physicians and clinicians identify there's criteria for that person, we may keep you up to 72 hours. It could be a maximum of 10 days. It really depends because every crisis looks different. Resolve is really a valuable resource in the community. There's not much quite like that. There was nothing like it when we first started it. And truly, we get to see people in their most vulnerable moments, potentially on the worst day of their life. And we get to do that work. And we work with you to try to keep you safe in your home. And again, try to maximize the coping skills and the strengths that you already have.
And to build on that, we're really built around this core idea that that individual, that person, they define their own crisis. The traditional psychiatric emergency model, and this is a little reductionist, it's like, you got to be this lethal to ride the ride. If you're suicidal enough, if you're homicidal enough, if you're impaired enough, great, we'll admit you. Otherwise, here's a list of resources, bye-bye, good luck back to the community. And Resolve and programs like ours are really about finding yes, that someone presents and says, I need help with blank. And our response is either, you know what, we have a lot to help with blank, or, you know what, let's figure out a way to help you with blank, right? That may not have been part of what we're thinking we're going to do in the first place, but guess what? We want to find a way to help you out. Not to replace any of the great services that are already out there, but to make sure that we can be a good pathfinder to help people get to the right resources.
And with the ongoing pandemic, can you tell us what changes or what you've been seeing as far as mental health crises and suicidality with relation to the public?
That's a great question, because what we're noticing is a huge demand in just behavioral health, and then the severity level, at least from an outpatient practice like ours, it's just been dramatic, the change. And so, yeah, what have you seen, and what advice do you have to clinicians and groups out there about, their approach and maybe how to influence their care?
I'm sure Dr. Rozel has a lot to say on this. I saw him get situated in the chair to give you a nice lengthy answer. I'll just preface, though, that yes, there's been some change, and at the same time, people need help, and the mental health system can be tough to navigate. And so we have steadily responded to calls, both from our mobile and phone services, as well as our walk-in residential services. I think for folks who are feeling disconnected or were feeling disconnected prior to the pandemic, of course, that only exacerbated those feelings, that isolation, the depression, the anxiety of the unknown. And I think while we don't get a ton of calls that say, I'm anxious about COVID, we get a ton of calls saying, I'm feeling anxious and I don't know why. I'm feeling lonely and I'm not sure what to do with this. And I think our job is to try to unwrap that package. When you're in crisis, you don't always know how to ask for exactly what it is you need. And we really pride ourselves on that's okay, because we all have needs, we all have struggles, and we will work with you to maybe figure out what is at the core of that. And to Jack's point, help be a pathfinder and maybe bridge you to the right service.
This is a disaster unlike any other in modern history. And so much of what we know about trauma and so much of what we know about community disaster response is single bad event, immediate recovery, get people out of the collapsed building, get people to the hospital, reunite families, and then we sort of move on and pick up the pieces of our lives. This is prolonged, it's chronic, it's ambiguous, it waxes and wanes. Some parts of the country are decimated. Some parts of the country, it hit much later, it hit in different ways. And behind all of this has been a lot of uncertainty, and uncertainty drives a lot of fear when there's mixed messaging, especially from, the people that we'd want to be, our public health communicators. It adds a lot to this. And so, yeah, as Liz said, people aren't necessarily picking up the phone and said, I'm stressed out about coronavirus, but they're saying, my sleep is terrible. I'm so stressed out. I can't focus. Or I'm cold because I haven't had a paycheck and I can't pay, the heating bill, or I'm about to, lose my housing because all these housing protections are, so hard to track. I don't have income. I'm worried about my kid. I can't do my job while I'm, the co-teacher. All this other stuff is what people are reaching out about. Now, it's interesting. There's been a lot of chatter about what's happening with suicide. And there have been isolated and very focused reports that in some very specific areas and some very specific groups, largely the groups that already were carrying, tremendous burdens of the, the social determinants of health and things like that, where we have seen increased presentations related to suicidality nationwide. But here's the thing. Nationally, so far, we don't really have great data. And the few places where we do have good data says that suicide rates are level, if not decreased. And historically, when we look at, pandemic incidents like this over the past, 100 plus years, we don't actually see increases in suicide rates during these events, even though the psychosocial stressors are horrific.
I'll just add that one thing we did learn, and we're continuing to learn, is people want to see humans in front of them. They want a connection. I think there's been a big push for tele. I know the country is figuring out remote work or some hybrid version of that, our patients, our consumers, this community, they crave connection. And it's comforting. And I'm really proud, I know Jack is proud as well, that Rozel has been able to continue to stand during this and to continue to provide service. It's incredibly important. And our consumers made that very well known. We want to see you. We want you in our home. We want to come to your building. Connecting virtually via Zoom doesn't really do it for them.
Yeah. And even though, across the broader field of mental health, I mean, we've seen expansion and extension into teleservices, the like of which I couldn't have imagined, 15 months ago. But, one of the things is, again, we do crisis work, right? People call us on the worst day of their lives for help. And it turns out, completely unsurprisingly in hindsight, that on the worst day of your life, one of the things that doesn't help is trying to figure out how to install a new damn app on your phone. Turns out this is not a great, approach to getting through the crisis. So yeah, again, that face-to-face, that personal touch is so vital.
One of the interesting things I think Rozel for myself and many others, it's oftentimes we have your cards in our desks, we have the phone numbers written down, we know how to pass it off. From your perspective, where do you think it would be helpful from the reverse? Where do you think the outpatient practitioners in the community could be supportive of Rozel? My experience has been it's more one way during these significant times. But I wondered, do you have any insight where you think a little bit more collaborative or a different approach in reverse would be helpful?
I'm sure there's a lot of opportunities where we could enhance that collaboration. And I appreciate the question. I think one of the things that we really value is rapport and history of information. So it's really common for us to call. I've done it myself. I have called a provider, and on the voicemail is my number, our number for Rozel. And I was like, oh, geez, if that's I'm the Rozel. So I would probably, if I'm in crisis, need to reach out, and that's certainly fine. However, there is value in somebody who knows you. We do try to partner with providers, community treatment teams to join us on those interventions so that we have some more information and the consumer doesn't have to be the only historian of what's going on. Because again, when you're in crisis, it's really hard sometimes to answer a million questions, to repeat information. We certainly don't want to re-traumatize our patients either by having to ask them really difficult and painful things. So to have a provider assist us, support us, and be present in that engagement only enhances the service for the consumer and family.
Yeah, again, accessibility, communication. Certainly, you mentioned earlier, lots of outpatient providers are getting lots and lots more referrals. Any, accessibility to those outpatient services is great. We want to help people connect to, resources that are a good fit for them, that are close to them. And then the other thing I'll say is, we do a couple hundred services every single day. And if we get it right 99% of the time, that means couple times a day we messed up, and we want to hear about it. We want to figure out what went wrong and how we can get it better next time.
Okay. No, that's a good point. I think feedback both ways is helpful. And so I appreciate kind of the feedback on how these outpatient practitioners can collaborate. So I think that's great. What are unique ways you're helping people with loneliness? Because I think I see that in my own office. I tell people, I'm pretty frank with them, to get the hell out of the house, follow CDC guidelines, but go connect. I come up with my own ways. How are you guys dealing with helping people connect in this very isolating time?
I think there's a lot of answers for that. And it's also extremely individual, right? It's dependent on each person and what they might feel most comfortable with. I certainly think at the beginning of this pandemic, when you could go outside and take a walk, that was helpful. It became like a mini vacation. And I think just any sort of exercise you can do, any sort of routine you can still engage in, getting dressed, getting out of the pajamas, whatever that might be for what your day-to-day looks like, I think is really important. And as much as we stress connection, so we would encourage people, call us if you're feeling lonely, use a peer support warm line if you're feeling lonely. PSAN is a great resource. I think too, knowing when to disconnect, right? Knowing when to disconnect from media, from the newspaper, from not reading every single story or looking up every single statistic on COVID and all of the symptoms and if the vaccination's coming out and when, because it consumes us. And so I think it's not just about connection, it's about what type of connection is going to be most useful to you. What you consume matters. And I think we've really tried to help people think of different ways to do that instead of our normal, let me go on the internet or let me read through the news or pop on the TV.
Yeah. Again, amongst bad things to be doing in a crisis, doom scrolling, right? But yeah, if we could change the messaging that we started off a year ago, the social distancing, absolutely no. Physical distancing, yes. Social connection, social strengthening. Use social media for social engagement, not for trying to find factual information. Use news for those sort of brief. I need a little bit of an information, need a little bit of an update, not for that continuous background noise. And, really sort of moderate some of those toxic things and find times to celebrate the small wins and build in those small positive activities, even if it's like, hey, you know what, once a week or once every other day, I'm going to take a few minutes and I'm going to reach out to a relative, a friend, someone who maybe I talk to all the time, maybe I haven't talked to in a while, to say, hey, how you doing, and check in.
One thing that comes up, unfortunately, we just haven't had the pandemic, and you highlighted somewhat the economics. We've also had a lot of social injustice issues occur, and politics that sometimes can be more impactful, maybe to some Americans than others. And so I think of my, my fellow neighbors who are of color. Is there any unique situations or things to be aware of as clinicians for our unique neighbors who are of color that you can maybe give us some advice on?
I mean, certainly, like you, we have watched events unfold throughout this country in waves. And we have had conversations with staff at Rozel about that so that we can ensure we're impacting our consumers in a helpful and productive way. I think ultimately, we serve an entire community and everybody is unique. Everybody has an experience, maybe some packed in trauma. Many groups feel marginalized in this country. And simply, I think, being aware of that first. And then second, asking questions. How are we going to be able to be most helpful? What will not help? We want to make sure we are walking a line where we're a useful resource. We don't want to be a hindrance. We do work very closely with the police at Rozel. That's a reality for us. And so we've had many dialogues with the county and amongst each other about how to do that in a safe and purposeful way for our entire community. And I think that's an ongoing dialogue. There's a lot to learn. We have a lot to learn. And I think, so while we want to disconnect from some things, there's value in reading what's going on in this country and how it impacts you personally and professionally so that you can deliver quality service.
I think the concept I come to over and over again is, the cultural competence. Yay, I'm a competent mental health professional. Cultural humility. How do I understand the meaning of your background and your experience to you, and find the balance of that individualized assessment, that individualized understanding, balanced again with the idea that it's not the responsibility of the minoritized people to educate me as a privileged person about their experience and, their values and what's important. And so trying to find that right balance. And sometimes, we talk about, these tough conversations, these awkward conversations. The reality, is that medicine has a long history of white supremacy and racism. And psychiatry has a long history of white supremacy and racism. And guess what? I have no evidence whatsoever that emergency psychiatry is any different. And we know from the entire process, it can be a big factor. If I have chest pain and I have a heart attack and my wife calls 911, there's a really good chance that a paramedic's going to show up. They're going to get me to the right ER. They're going to get me to the cath lab and blah, 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 blah. If I have a manic episode, if I have a psychotic break, if I'm having PTSD flashbacks, police may be that first responder. Okay, so again, we've brought armed people to the front door just as if we'd ordered a pizza for a person in crisis, possibly suicidal crisis. Very high risk. And now there's a risk that my mental illness, that my crisis, that my poverty, that my social stressors can become criminalized. There's a possibility I might get arrested. There's a possibility there would be use of force, or that I could even be killed. And even though that's rare, that's a real thing. And that's something that people living with mental illness and the loved ones of people with mental illness often have in the back of their mind when they're trying to figure out, how do I help my loved one, and how ill do they need to be before I'm willing to accept some of those risks. And when you're a person of color, family of color, that equation shifts yet again. And so that's something we've got to be very sort of humble about and very thoughtful about. And it's a conversation we're having here at Resolve. It's a conversation we're having nationally. I do a lot of work with national groups, the National Suicide Prevention Lifeline, about sort of how do we think about, what are our interventions for those immediate risk cases? Because we're a little bit more mindful and thoughtful about some of the ramifications. And no matter what, if you're in crisis, to be transported to a hospital by law enforcement may be the critical necessary thing to get you life-saving help, but it's really hard to start that road to recovery handcuffed in a police vehicle. It's a really, really painful way to begin that. And what we say in crisis, never let a good crisis go to waste. We've had a crisis for a while. We've recognized the crisis a little bit better more recently. And time for us to really think about what our options are to address that.
Do you have any advice for our listeners who may be clinicians throughout the country where they live in a county where there is not 24/7 crisis help for people? Do you have any kind of words of wisdom for them, or anything you could share regarding that could be helpful?
Move to Pittsburgh. So we are ridiculously well resourced here in Allegheny County. The joke, and I don't like this joke, is you can't throw a rock in Pittsburgh without hitting a psychiatrist in the back of the head. Don't like that joke, but it's true. We got lots of resources, and yet still, if I needed help right away, if a loved one of mine needed help right away, to get into outpatient therapy, to get into an outpatient program, there's hurdles and there's barriers. What we don't have now, but what we're about to have nationally, is a much improved crisis line network. Lots of people are familiar with the National Suicide Prevention Lifeline, the 1-800-273-TALK network. Resolve is one of about 180 member network centers. By July 2022, all the major carriers will be mapping 988 onto the National Suicide Prevention Lifeline network. And in line with this, there's a broad strategic effort coming out of SAMHSA to create comprehensive crisis services that, frankly, will look a lot like what we're lucky enough to have here in Pittsburgh. As Dr. Everett at SAMHSA talks about, it's someone to talk to, phone services, someone to come to you, mobile services, someplace to go, walk-in and residential, and finding a way to build out those programs nationwide, and knowing that what scales really nicely in Pittsburgh may not scale as well in rural Pennsylvania or rural Utah. Yeah.
Wonderful.
And by the way, one of the great things about what we do at Resolve is there's no charge to the individual. So no one has to be thinking, I need help, but I don't have money for a copay, but I already have debt. You just have to think, I need help, or I think I might need help, or I think someone I care about might need help. You pick up the phone, you call. We're gonna be with you in that crisis, and we're gonna help get you through it.
Wonderful. Well, thank you both very much for being here with us today. Our listeners, I'm sure will find this very helpful. So we really appreciate the information and the insight, and we appreciate you for taking the time with us today. So thank you so much.
Thanks for having us.
Thanks for having us. It's been a delight.
Thank you everyone for joining us this week, and we look forward to seeing you again on The Barrier Breakdown. Take care.
Thanks for listening to The Barrier Breakdown, Disrupting Mental Health podcast. Check out our website at cbicenterforeducation.com for more information and to learn about upcoming continuing education events.